Warning: watch this video or you will regret it. In old age, many people still think they are healthy just because they do not feel obvious pain. But there are diseases that are not noisy, do not cause immediate symptoms, and type 2 diabetes is one of them. It develops silently in the body of the elderly until it causes serious damage to the heart, kidneys, eyes, nerves. When it is discovered, it is often too late. Today's video is a warning for everyone. Do not be subjective with type 2 diabetes, the silent killer of the elderly. The disease is painless, but silently destroying the body. Unlike many other diseases, type 2 diabetes often does not cause pain or dramatic symptoms in the early stages. Many elderly people still eat and live normally until one day they suddenly receive a diagnosis. Blood sugar is too high. They have diabetes. The problem is that for a long time before that, the body has been silently damaged. High blood sugar is like a sweet poison that infiltrates and destroys small blood vessels, from the eyes, heart, kidneys to peripheral nerves. The patient may still feel healthy without any pain, but inside the body is being eroded little by little. Many people only discover the disease when complications appear. Blurred vision, numbness in the limbs, slow healing infections, even heart attacks or strokes. At that time, they go to the doctor, but the damage has lasted for many years. More worryingly, type 2 diabetes is often mistaken for signs of aging. Older people often feel tired, have a dry mouth, are thirsty, and lose weight. These signs are easily overlooked because they think the body's getting weaker. But in fact, they are early warning signs that many people do not pay attention to. Remember, type 2 diabetes is painless, but it is still one of the most dangerous diseases. Its silence makes patients subjective, and its silent destruction makes complications more serious than ever. Early detection and regular checkups are the key to avoiding the situation of discovering it too late. Who is susceptible? And the silent signs to watch out for people over 60 years old are the group with the highest risk of type 2 diabetes. As age increases, the cells in the body gradually become resistant to insulin. That is, although the pancreas still produces insulin, the body cannot use it effectively. Blood sugar gradually increases, silently accumulating into disease. In particular, if the elderly have the following factors, the risk increases sharply: overweight, abdominal obesity, lack of exercise, high blood pressure, increased bad cholesterol, having a blood relative with diabetes, having had gestational diabetes or impaired glucose tolerance before. These factors are like a smoldering fire. Just a little subjectivity is enough for the disease to flare up. Although the disease progresses quietly, there are still small signs that need special vigilance. For example, frequent urination, especially at night, constant thirst, eating normally but still losing weight for no apparent reason, often feel tired or sleepy after eating. Unfortunately, these signs are often mistaken for old age, causing patients to not go to the doctor early. In addition, symptoms such as slow healing wounds, frequent skin infections, genital yeast infections, sudden blurred vision, or numbness in the limbs can also be signs of prolonged high blood sugar that is destroying the immune system and nervous system. Note in particular, there are people who do not have any obvious signs, but when they go for a general health checkup, their blood sugar is found to be above the threshold. Therefore, regular health checkups, measuring fasting and post-meal blood sugar are the most effective ways to detect the disease early, even when the body has not spoken. Poor control. The price to pay is devastating complications. Type 2 diabetes does not kill people immediately, but if not well controlled, it will lead to a series of serious complications, affecting most of the important organs in the body and is especially dangerous in the elderly. The first is cardiovascular complications, the leading cause of death in people with diabetes. High blood sugar damages the blood vessel walls, making them susceptible to atherosclerosis and blockage. The result is myocardial infarction, stroke, high blood pressure, events that can happen suddenly without time to react. The second is kidney complications. People with long-term type 2 diabetes, if not closely monitored, are very susceptible to chronic kidney failure. Some people, when discovered, have kidney damage to the point of having to undergo dialysis for life, which is both costly and severely affects the quality of life in old age. The third is neurological and lower limb complications. High blood sugar damages the nerves, leading to numbness in the limbs, loss of sensation, and an increased risk of falling. Worse, if there are ulcers on the feet, the body will have difficulty healing and will be susceptible to infection. Many people have to amputate their toes and feet just because of a small wound that was not detected in time. It is impossible not to mention eye complications. Very common but easily overlooked. Diabetes can cause retinal hemorrhage, cataracts, glaucoma, leading to severe vision loss, even permanent blindness. Sadly, many elderly people only go to the hospital when the complications are severe, and at that time, doctors can only try to slow down the process, but cannot completely reverse it. Therefore, understanding these complications is the first step to limiting unfortunate consequences later. Living with diabetes. Not easy, but completely possible. Elderly people, when diagnosed with type 2 diabetes, are often confused, afraid that life from now on will be full of prohibitions and suffering. But the truth is, diabetes is not a death sentence if the patient understands and controls it properly. Millions of people around the world still live healthy, happy lives for many years despite having the disease, and you can too. The first key is a reasonable diet. People with diabetes do not have to abstain to the extreme, but need to eat right, eat enough, and eat regularly. Prioritize green vegetables, low-sugar fruits, whole grains, fish, beans, and limit refined sugar, animal fat, and processed foods as much as possible. Most importantly, eat on time, do not skip meals, and avoid sudden increases and decreases in blood sugar. Gentle but regular exercise is also a precious medicine that costs nothing. Just 30 minutes of walking a day or doing aerobics, cycling, swimming also helps the body use insulin more effectively, thereby stabilizing blood sugar. For the elderly, exercise also helps prevent osteoporosis, improve mental health, and reduce the risk of cardiovascular complications. In addition, compliance with treatment and regular health monitoring are vital factors. Do not stop taking medication on your own or change the dose without consulting your doctor. Regular blood sugar checks, eye exams, and kidney exams all help detect complications early and control them promptly. Do not wait until symptoms appear to go to the doctor. Finally, and very importantly, is the spirit. Patients need to keep a comfortable mentality and avoid stress, because stress can also increase blood sugar. Consider diabetes as an unwanted friend, but if you know how to behave, you can completely live peacefully with it. Type 2 diabetes does not choose anyone. It quietly comes to those who are subjective. And when it comes, it not only affects health, but also makes old age tiring, associated with medication and complications. However, if detected early and controlled properly, you can still live happily, healthily, and freely in old age. Let's start paying attention to blood sugar for the safety and peace of yourself and your family.